Smiley piercing. Healing time, 3 to 6 months. Keep your jewelry in for the entire healing time. Do not remove it to clean or change it. If you would like to change out your jewelry while your piercing is healing, we can change it for you. Jewelry worn in healing piercings needs to meet very specific requirements, so we cannot change it to outside jewelry while your piercing is healing. Oral piercings can swell a lot. Eating and drinking cold things such as popsicles, ices, etc. can help decrease swelling. Avoid eating and drinking hot foods while your piercing is swollen, as this can make swelling worse. Other things that can help decrease swelling are arnica pills and over-the-counter anti-inflammatories such as ibuprofen. To clean your piercing, we recommend swishing your mouth with clean water after eating or drinking anything besides water for the entire healing period. Be sure to maintain good oral hygiene while healing your oral piercing. This includes brushing your teeth morning and night and flossing daily. Once you are able to do so comfortably, you should scrub your jewelry with your toothbrush daily to prevent plaque buildup. If you use mouthwash, make sure you do not use it more than twice a day, as too much mouthwash can cause a pH imbalance in your mouth. It is also very important that it is alcohol-free mouthwash if you have a healing oral piercing. It is also important to not use whitening toothpaste or mouthwash while healing an oral piercing. Double check your toothpaste and mouthwash to ensure that they do not contain hydrogen peroxide. Do not drink alcohol for the first week after getting an oral piercing. Alcohol can lead to excessive swelling and increased bleeding. After the first week, keep it to a minimum while healing, as alcohol coming into contact with a healing piercing can irritate it. You also should not smoke with a fresh oral piercing. If you decide to smoke despite the risks, we would recommend rinsing your mouth with clean water afterwards. We recommend avoiding spicy and citrusy foods for the first week, since they may not feel good on your fresh oral piercing. Do not bite, pull, or play with your jewelry with your teeth. Not only will this damage the healing piercing, but it can also result in tooth damage. If you ever do have to touch your healing piercing, be sure to first thoroughly wash your hands with hot water and soap to avoid infection. The easiest way to get an infection in a healing piercing is by touching it with dirty hands. You also want to make sure that everything that comes into contact with your healing piercing is clean. You should keep your healing piercing out of unhygienic bodies of water to help avoid infection. This includes swimming pools, hot tubs, lakes, oceans, rivers, etc. The more healed your piercing is, the less likely it is to get infected, but if it is still healing, there will still be some risk of infection if exposed to bacteria. Some water also carries more risk of infection than others. Natural bodies of water such as lakes, oceans, and rivers carry the most risk, since this is where a lot of the really scary bacteria tend to live. We would recommend being extra cautious around them with a healing piercing. Swimming pools and hot tubs have chemicals in them that help kill some of the bacteria, making them less risky. These chemicals don't kill all of the bacteria though, so there is still some risk, and the chemicals themselves can also irritate a healing piercing. When you first get pierced, your piercing will look pretty imperfect since it hasn't had a chance to get mad yet. Over the first few weeks, it will start to look more and more like a healing piercing. Things you can expect to see with your healing piercing are some minor redness, minor swelling, small amounts of clear, white, or tinged yellowish goopy discharge, and minor pain and tenderness. Some minor spotting from your piercing can be normal as well. These will eventually become less and less until the piercing is healed and it looks like a pretty and perfect piercing again. The best way to tell if a piercing is healed is all goopy discharge and crustiness will go away, along with all pain and tenderness. If your piercing still gets goopy or flares up from time to time, it is still healing. What would not be normal is if your piercing is extremely red, extremely swollen, such as to the point that the jewelry is putting pressure on the skin, large amounts of goopy discharge, especially if it is a dark yellow, greenish, or chunky, or extreme pain and tenderness that does not subside after a few hours. These can be symptoms of an infection. If you suspect an infection at any point, you should speak to a licensed medical professional as soon as possible. If you ever aren't sure if something is normal or not, please reach out to us. While we are not medical professionals, we deal with piercings on a daily basis and are always happy to help out and let you know if something looks okay or not. We are also able to help troubleshoot minor piercing complications. Most piercing complications that may occur tend to not be too serious.